Welcome to In the Community with Tiffany K.
And we're back within the community. I'm Tiffany K. And today we have a very big topic to talk about, especially because it is American Heart Month. So I have Dr. Dhillon with me this morning. Dr. Dhillon, how are you doing today?
I'm doing great. Good morning. How are you?
I am great. Thank you so much for being on with me to talk about such an important topic today. But before we jump into that, I do want to get into your background a little bit, where you're at now and all the good stuff. So let me have it.
So I have been in the community for last 11 years. I am a triple board certified physician. I am board certified in obstetrics and gynecology, my primarily specialty. And then I'm subspecialized in maternal fetal medicine, which is taking care of women who have high-risk pregnancies. I have special interest in obesity and wellness. So I am also board certified in obesity medicine.
Okay.
I have been in Fredericksburg for 12 years. We have our maternal fetal medicine practice, and we also have our wellness center, where our goal is to keep our society healthy and well.
And where is your wellness center located?
So we have two locations. One location is right here in Fredericksburg off of Route 1, 412 Cambridge Street. And our second location is in Springfield on Alma Lane, 5514 Alma Lane.
Perfect. So in other words, you're definitely an expert to be able to talk to about American Heart Month today.
I think I can talk about it.
I
Yes,
think so too. So let's just jump right into this. Of course, heart disease is a big risk in a lot of people's families, unfortunately. And so I want to start off with, what are some of the risk factors that contribute to heart disease, and what steps can we take to mitigate the risks? Because I know that's going to be the biggest question we're going to ask.
Absolutely. So when we talk about risk factors for heart disease in adults, so these risk factors include high blood pressure, high cholesterol, inactivity. These are patients who do not do a lot of physical exercise just because they don't have time, or they have just not included that in their regular lifestyle. Obesity is a big contributing factor. And then social habits such as smoking, excessive alcohol intake, diet plays a very big role, and underlying medical conditions such as diabetes and family history of heart disease is important. To answer your second question, what are the steps we can do to take or to mitigate these risks? So for that, I usually recommend, very important for all of us, to adopt a healthy lifestyle, which includes regular exercise, maintaining a balanced diet, which is low in fats and sugars, low in sodium, avoiding smoking, also avoiding excess alcohol consumption. Very important to manage stress. In all of our stressful lifestyle, it's important to manage stress because stress is a very major risk factor for heart disease. And then for patients who have high blood pressures, monitor your blood pressure, control your blood pressure, having a healthy cholesterol levels, diabetes patients having healthy or normal levels of blood glucose. For that, regular checkups with your healthcare providers, and take medications as necessary.
So would you say it's never too late to start a healthy lifestyle? Because I'm sure there's some people listening that are like, I've tried, or I'm just too far down the path of an unhealthy lifestyle. I don't know if I can do it.
Absolutely. That is never too late. I see patients all the way from teenagers till they are more than 80 years of age. And I always tell them it's never too late. Studies show that the impact on your health starts pretty quickly after you start exercising or implementing a healthy lifestyle. So there is never too late.
Now, in terms of talking about heart disease, I know you gave us some of the risk factors, but are there any specific symptoms that we should be particularly aware of? And, how can those differentiate from other health conditions?
So symptoms of heart disease, which we require to be very vigilant about, include chest pain or discomfort, symptoms such as shortness of breath, fatigue or being tired, nausea. Some patients may present with lightheadedness or palpitations. Also, when the heart disease is chronic, that means it has been there for a little bit longer. Patients will have swelling or can have swelling in their legs, ankles, and feet. Now, these symptoms can be indicative of various heart conditions, such as coronary artery disease, which are the little blood vessels of our heart, which are actually giving blood to the muscle of our heart, or they can be a sign of developing heart failure. It could be due to arrhythmias or different valve disorders, the little valves which are in our heart. Those disorders can also present like that. Differentiating these symptoms from other health issues often requires a medical evaluation, as some of these symptoms can overlap with conditions such as acid reflux, anxiety, stress, or even musculoskeletal disorders, which can present with these vague symptoms sometimes.
I think that's important to know because, of course, as we know, a lot of those symptoms can overlap. And you may think it's one thing, and then you happen to find out it's something else. So I think also being vigilant and going to see your doctor to make sure you're having regular checkups would also be a good idea.
Absolutely. This is also very important with patients who have underlying disorders, such as patients with diabetes. Sometimes because they can have end organ damage, what we call it, that means their symptoms can be very silent. So I don't recommend patients, if you have these symptoms, please call your doctor, please call your physician or your healthcare provider and get help.
And you were just talking about diabetes and I know hypertension is also a pre-existing condition that could contribute to this. What are other precautions that people need to take who do have these conditions to safeguard their heart health?
Great question. So, patients who have underlying conditions or pre-existing conditions such as diabetes or hypertension, they need to take additional precautions to safeguard their heart health by closely monitoring and managing their conditions, which includes taking medications as recommended by their healthcare provider. Make sure they have regular medical checkups, very important. We all get busy and you keep putting off your visits, but that's not acceptable for these patients because it can be dangerous for their heart. And lifestyle modifications, the recommendations, as I said earlier. So very important to maintain a healthy weight, follow a balanced diet, engaged in a regular physical activity. And if patients are smoking, quitting smoking can be very good for your heart health. Alcohol, make sure you take a limited intake of alcohol, and stress management. I can't say that enough. Stress management, learning the strategies to manage your stress effectively is important for these patients.
And I think those are just everyday things we all could use anyways in terms of learning stress management and all of that.
Absolutely.
I'm speaking with Dr. Dhillon about American Heart Month, which is this month, and heart disease. Now, earlier you were talking about obesity, and how does that affect heart disease in patients? Does it make them more at risk?
Obesity significantly increases the risk for heart disease by contributing to other factors such as high blood pressure, high cholesterol, and diabetes, which we see in a lot of patients. Like I see a lot of patients for weight management, and this is usually they don't just present with diabetes, with the obesity. They actually have high blood pressures. Most of them will have diabetes. Most of them will have high cholesterol. Also, when a patient has a high excess weight, that puts a strain on his or her heart, and it can lead to conditions such as coronary artery disease, heart failure, and arrhythmias. Managing weight through a combination of healthy diet, regular exercise, lifestyle changes, and some new generation medications that we have for weight management can reduce the risk of heart disease in obese patients. We actually see and we recommend that patients who are overweight, for the benefit of their heart, we recommend losing at least 10% of body weight. And this is where we start seeing the benefit for the heart. So if I'm seeing a patient and he is 300 pounds, once we reach 270 and we lost about 10% of the body weight, this is when we are going to actually see the positive effects for the heart health. So obesity plays a very big role for heart disease.
And yeah, I kind of want to switch directions here a little bit. When we're talking about heart disease, it affects men and women both. But what I understand is that it actually affects women in a different way, and more often women. So why is it important right now to raise awareness about women's heart health during this American Heart Month? And how does that compare heart disease within women and men?
So being a women's healthcare specialist, this is always very close to my heart.
Of course.
And I think raising awareness about women's heart health during American Heart Month is crucial because heart disease manifests a little differently in women as compared to men. And women are often underdiagnosed and undertreated. Women may experience, yes, it's very interesting, and we have this well-published data which actually shows that women are underdiagnosed or undertreated. And there are multiple reasons for it. One of them being women may experience more subtle signs of heart disease, such as fatigue, shortness of breath, discomfort in the neck or jaw and the back or in the upper back, rather than the typical chest pain that you see on TV commercials, a man holding a chest. Female patients may not present like that. She might have more vague symptoms. So that's why it's important to raise this awareness on American Heart Month about women's heart health. And additionally, certain risk factors such as diabetes and mental stress may have a greater impact on women's heart as compared to their male counterparts.
Interesting. Wow. I'm kind of just like thinking about the differences between the two. And as I'm saying, it's not, heart disease can affect both men and women, but it's definitely harder to, I think, identify in women, as you have pointed out, with either calmer symptoms or just the different stresses that they go through in our life. So what are those common misconceptions or myths that are surrounding women's health that we can help try to debunk at this point?
So if you look at women over 50, the number one killer, if you ask anyone, they will say, oh, it's breast cancer, it's colon cancer.
Right.
No, actually, number one killer in women over age 50 is heart disease.
Oh, interesting.
Yes. So common misconceptions which surround women's heart health include a belief that heart disease primarily affects men, that we as women are not at risk until menopause, and the symptoms always include severe chest pain. So these are the common myths. The truth is, yes, our hormones do protect us against heart disease till we reach menopause or about 50 years of age. But that doesn't mean women are always protected. Yes, for women, the risk is lower as compared to men until menopause. But after that, it's actually the same. So debunking these myths involves educating patients about the prevalence of heart disease in women, the importance of recognizing atypical symptoms in our female patients, and the need for early detection and prevention strategies which are tailored uniquely just for women's health.
Interesting. Okay. I'm speaking with Dr. Dhillon. She's given me a lot to think about already during this American Heart Month, talking about heart disease in both women and men, but especially women. And, some of the factors that can play into this, of course, women go through different things in their lifetimes. So what role, I want to go through a couple of these. First off, let's start with pregnancy. What role does that play in women's heart health? And are there any long-term effects or considerations that women should be aware of if they are postpartum?
So pregnancy can affect a woman's heart health by increasing the risk of conditions. For example, patients who have gestational hypertension or hypertension or preeclampsia, or even diabetes, gestational diabetes or pregestational diabetes, that means diabetes during pregnancy, or they already had diabetes when they got pregnant, that predisposes women to have heart disease later in life.
Oh, wow.
Patients, yes, very interesting. So, postpartum, women should be aware of potential long-term effects, such as persistent high blood pressure. That means the blood pressure can stay high even after delivery, because usually patients with preeclampsia or gestational hypertension, the blood pressure normalizes after the baby is born. But in some patients, it doesn't. So patients or women should be aware of that, that can increase risk for developing cardiovascular diseases. And what studies show that women who had hypertensive disorders, that means if they had high blood pressure in pregnancy, which is called gestational hypertension, or preeclampsia, their risk of developing heart disease is double as compared to women who didn't had any blood pressure issues during pregnancy. So I recommend that all these women have regular follow-up appointments with their healthcare providers and adopt a healthy heart habits, which are very important to mitigate these risks after they have their baby.
And is there anything that women can do who are currently pregnant to limit the risks as well, or anything to be aware of besides postpartum while they're currently pregnant? Is there anything else that they should be doing?
They can do a lot of things. So first of all, even before patient gets pregnant, I always say weight management can change the life of the mother and her baby and a woman's life later. Because once patient develops hypertension in pregnancy, there is no cure for it. We can treat it during the pregnancy if we need medications, and then we keep a close eye on the pregnancy, and then we deliver them according to the guidelines. But during pregnancy, other than there are some recommendations in pregnancy, following those recommendations just for her safety and her baby's, unborn baby's safety, there is nothing she can do during pregnancy, but she can do a lot after delivery. Maintaining a healthy weight, quitting smoking or not going back to smoking if she was before pregnancy, having a healthy diet, which is low in salt, low in simple carbohydrates, eating high protein diet, making exercise a part of her daily routine, maintaining a healthy weight, having routine follow-up checks with her healthcare provider. All of those can reduce her risk for developing heart disease later in pregnancy, because the truth is all of us are getting older. Most women, young women have babies in 20s and 30s, but their risk of heart disease increases, and which may not show up right away, but it will eventually. But that risk can be reduced by following those recommendations.
And, speaking of something else that's very unique to women, menopause, how does that affect a woman's heart health, and what strategies can, women employ? The same idea, this cardiovascular wellness in their life before then, or even during that phase.
So menopause can affect a woman's heart health due to hormonal changes, that may lead to increased cholesterol, weight gain, and changes in blood pressure. All of these things I see very frequently after menopause. Like I said earlier, the hormones that our bodies have protect us till menopause. But as soon as the menopause hits, all of these changes, which are not heart healthy, can happen to a woman who is postmenopausal. So to maintain a healthy heart, or for her cardiovascular wellness during this phase of life, women should focus on adopting a heart healthy habits like regular exercise, balanced diet, weight management, stress reduction techniques, and avoiding smoking. Also, hormone replacement therapy can be considered under the guidelines, under the guidance, and under the following the guidelines right after delivery. We do not recommend waiting 10, 15 years, because studies do not show that we may have a cardioprotective effect at that time. But if a woman has just gone into menopause, she should talk to her healthcare provider and consider hormone replacement therapy if she's a good candidate for it. And that might actually be good for her heart health.
And what I'm understanding is a lot of these are preventative measures, correct? It's better to get started early on than while it's happening.
Absolutely. Absolutely. Prevention is better than cure. So when it comes to heart health, we need to start protecting our cardiovascular health early instead of waiting when it's too late, because then only treatment is medications.
I'm speaking with Dr. Dhillon. It is American Heart Month this month. We're talking about heart disease, specifically with women. So let me ask this. You kind of touched on it a little bit earlier, but I want to dive deeper into it. How do some of the lifestyle factors such as, stress, exercise, diet impact women's heart health? And what are some of the practical tips for kind of incorporating these heart healthy habits? Because, it's easy to say, it's easier to say, oh, go do a healthy diet, but where to start, or go start exercising, where to start is always the question.
So practical tips for incorporating heart-healthy habits into your everyday life includes choosing foods which are rich in whole grains. So, for example, oats, whole wheat bread, having whole wheat pasta instead of going into more processed foods. Diets which are rich in green leafy vegetables and fruits with a low glycemic index. When I say that, fruits such as grapes and oranges may have high glycemic index. But fruits such as berries and apples with the low glycemic index. By glycemic index, I mean they don't raise your sugar as much. And as we know, sugar is not good for your heart. So choosing those diets will be important. If we talk about exercise which is good for heart health can be brisk walking, cycling, swimming, whatever you enjoy. So if I have a patient who says, you know what, I hate running, but I love swimming. Sure, go for it. Swimming is great. Any of those exercises, I tell my patients, you're going to stick to your habits which you actually enjoy. So if you say, I like to run, sure, definitely. Somebody who says, I don't like to go bike outside or here when we have cold weather, but I can go to my basement and I can be on my elliptical for 20 minutes. Perfect. So any of those which you enjoy, we recommend about 150 minutes per week, or easy way to remember 20 to 30 minutes every day will be important. Stress management, very, very important, especially for my female patients.
Yes, definitely hard to do.
Very hard to do. I am myself a working mom, and it is not easy. We wear many hats in our life. Mm-hmm. So stress management, one of the things I always say, make your schedule, stick to your schedule. Other things with stress management is whatever you enjoy, try to do that. Practice mindfulness. Things such as yoga, meditation, also maintaining social connections, which are important for your emotional health. Because patients, when we don't have good stress management, it's a vicious cycle. But because somebody who's stressed are going to have high levels of unhealthy hormone called cortisol. This hormone is associated with weight gain, diabetes, high blood pressure. So to break this cycle, very important to manage stress, do things, self-care, very important for women. Whatever you like doing, at least every day, have 20 minutes as my time for yourself. And that's important for your overall health and definitely very important for your heart health.
And I love the way that you put that, because a lot of times we're focused on we have to have a healthy diet, we have to exercise, but we forget that there's a whole body approach that includes the mental health, the emotional health, taking that time aside. And especially for women, as you pointed out, we wear many hats in our lives. We're always kind of serving those around us. So it's important to take that me time.
Absolutely. I can't emphasize that enough. I tell that to my patients every day. And that me time will make you a better professional, a better mom, a better patient, a better member of the society. So having that time for self-care, just 20 minutes every day, is very important.
And as speaking with Dr. Dhillon, all about American Heart Month, we've gotten a lot of information today about what heart disease is, what are the symptoms that we can watch out for, how can we limit the risks that we have to heart disease. So what are some of the resources or support networks that are available for patients who may want to know more about this heart disease and who are concerned about their heart health in general?
So there are a lot of resources which patients can go to. And I always say, start with your healthcare providers. There are a lot of patients who already have heart disease. There are good cardiac rehabilitation programs. They can go to that. There are a lot of good online support groups, online forums, a lot of educational websites. I always recommend going to some good medical schools, websites, or websites which are .org, so you get the good information instead of having non-evidence-based criteria, and then national organizations such as American Heart Association, CDC, Women Heart. These resources offer information, guidance, and emotional support for individuals who are seeking to prevent or manage heart disease through lifestyle modifications, medical management, and medical treatment when it's necessary, and community engagement.
And are there any other, as we wrap it up here, any other tips or advice that you would like to give to all of our listeners when it comes to heart disease and things to be aware of during this American Heart Month?
I always say start early, don't wait. Even in our country right now, teenage pregnancy is at the rise. Our obesity rate is 40%. So to protect your heart, start early. It's never too late. Every little bit counts. If you have a busy day and you could not do your 20 to 30-minute exercise, but you could only do 5 minutes, that's better than doing nothing. Diet, we are all busy, but avoid processed food, avoid simple sugars, stick to a healthy, high protein, high green vegetable diet, and every little bit count. And please take care of your mental health. That is very, very important.
Some great advice, especially today and during this American Heart Month. And I think a lot of people can benefit from this. Dr. Dhillon, thank you so much for coming on with me today to bring some valuable information and just make people think that it just takes a little step to get started on something like this.
Thank you so much. A pleasure to be with you.
Have a great day.
You too. Thank you.
And that'll do it for In the Community this week. If you are a nonprofit and need to bring attention to your cause or organization, please reach out through this station's website, and we will see you next week.